Good afternoon and welcome. We are so pleased to have you join us for today's webinar, Understanding the Link Between Firefighting and Cancer, Opportunities for Prevention and Awareness in Partnership with Women for a Healthy Environment. My name is Andre Green, and I serve as the Associate Director for the Cancer and Environment Network of Southwestern PA. Our primary mission is to empower the people of Southwestern Pennsylvania with the scientific knowledge and collaborative tools needed to take action against environmental cancer risks and advance health equity. So turning to today's discussion, we are so fortunate to be joined by Michelle Nakarita-Chapkas and Dr. Kenny Fent for today's topic. Both presenters will highlight the carcinogens firefighters are exposed to, the types of cancers prevalent in the profession, and current research on the link between firefighting and cancer. Throughout the presentation, we highly encourage you to submit questions that you have throughout the presentation into the chat. We will address all those questions in order immediately following the presentation during the Q&A section. Thank you so much for being here. Michelle, the floor is yours.
Thank you, Andre. Good afternoon, everyone. It's a pleasure to be with all of you. I'm certainly honored to be in this conversation and to have a dialogue about understanding the link between firefighting and cancer. This is something that our organization at Women for a Healthy Environment has been focused on for quite a few years. Actually, back when we were all working collectively across the country to update TSCA reform, which was the Toxic Substances Control Act, which moved into the 21st Century Chemical Safety Act, of which guides all of the chemicals in commerce and those things that firefighters are exposed to when they fight a fire, and have had a lot of great opportunities to work with firefighters throughout that process in terms of an advocacy role. And so we can talk a little bit more about that, but I'm here to tell you a little bit about the organization and then our experience from an advocacy perspective and community programming and education and awareness around this space. And then we'll turn it over. So with that said, just to give you a little bit of background, Women for a Healthy Environment, we use a scientific approach to achieve equitable lives free of environmental hazards through advocacy, as I just mentioned, and community-based programming. So we focus on those environmental exposures that impact public health. And this is certainly an example of what we're going to be talking about today. We do that through building resiliency across communities, promoting equity, and then certainly educating communities as well. And forums such as this are really, really important because we can take this information and share it with friends, neighbors, colleagues, family members, et cetera. This is really a critical conversation that I hope gets a lot of information sharing across the Commonwealth and frankly beyond. So with that said, to give you a little bit of background, we have three main programs. Healthy Homes is one. We identify and address those health risks in the home setting, like lead and radon and poor indoor air quality. Our community health workers go out and do healthy home assessments to look at that risk of exposure and provide resources to residents and community like air and water filters and dehumidifiers, and green cleaning kits and such, that, again, focusing on the toxics exposure that could be in our surroundings and how to reduce that risk. And then our early learning and our healthy learning, rather, we are in both the school and the early learning space. And we're in those spaces as well because we're looking at creating healthy spaces where children can thrive, where they can grow and learn and lead their fullest academic potential as well as developmental longevity in terms of their academic careers and such. So, we know that where children learn and where children live have an impact on their academic outcomes. And so we have several programs that do that. And we go into schools and early learning centers and we test and we mitigate. We look for those solution-based approaches. So we test and mitigate for lead and for radon and other preventable exposures that preventable environmental risks that we know we can address. So with that said, and here's a picture of one of the contractors that had gone into an early learning center and was testing for lead in that particular space. And when we find lead, we fix it. Those are some of the things that are important to the organization. But in particular, we also have health policy. And so we work at the local, state, and federal level. I start off by talking about TSCA reform. And in addition to that, we're working on several bills at the state level, and two of them actually address PFAS. And so it's an important conversation here today and how residents can be advocates in using their voice to reach out to their legislative officials, those elected leaders, and saying, we've got some strong bills in both the House and Senate that you all can be advocates for and help push over the finish line. And then certainly at the local level. Our outreach, we've done some work on PFAS in terms of looking at that exposure and where it exists in our three rivers here in Pittsburgh, along the Allegheny, Monongahela, and Ohio rivers. And it's important to think about where all of our exposures to PFAS exist. And this is one in terms of water. Our exposure exists in terms of routes of exposure. We inhale it, we absorb it, we ingest it through water. And so these are all the things that are important to educating the community for how to reduce that risk. So let's just talk a little bit about what happened, because I think that kind of sets up the discussion for today about how to avoid this in the future and how to, again, reduce risk, reduce exposure. So in July of 2021, in McKeesport, PA, which is just a little south east of Pittsburgh, along the Monongahela River, and intersects with the Youghiogheny, there was an auto body shop. That auto body shop had caught fire. There was a power line that had fallen. And so as a result, if you think about an auto body shop, think about all of the things in that particular occupational setting, right? That all of the things that mechanics deal with to fix your vehicle. Thinking about the stains and the paints and the oils and the lubricants and all of those types of things. So essentially, it was a very hazardous fire because of all of the contents of that auto body shop. And as a result, when it happened, there were both the McKeesport Fire Department and local volunteer fire departments came to take care of that fire. They had a challenge doing that and had asked for additional resources. And when additional resources came in, there was a unfortunate situation in that when they were putting the hoses into the fire hydrant, it backflowed because they were bringing in this firefighting retardant known as AFFF to fight the fire because the water suppression wasn't doing it with the various chemicals in this particular scene. So they brought in the firefighting foam to doing that and to suppress this fire. When they hooked up those hoses to the hydrant, it backflowed into the water system. And so there was a little bit of a concern at first that perhaps it had gone through the system. And so the Municipal Authority of Westmoreland County was immediately notified. And when that happened, then they had to turn off the access to the water to really do an investigation and see what level of contamination existed. So that day, as you can see on the heading here, the residents were told not to drink the tap water after the commercial building fire that had existed because there was risk of exposure. They were aware of chemicals that were used in the firefighting foam, the AFFF. We know that it contains PFAS, a carcinogen, and so there was concern about resident health. So a water alert was immediately issued then. And this is something that was in the local papers. So the Municipal Authority of Westmoreland County had advised its residents in what is known as the lower 10th ward of McKeesport to not use that tap water after the firefighting foam had been essentially sucked into the fire hydrant as crews battled this particular fire. So there was an advisory posted on the municipal authority's website early that morning that the foam contained synthetic chemicals, which can be a serious health concern. And then that really got the community then asking questions and wanting to learn more, frankly. So this is a map of the area, and this map describes the lower 10th ward. And as you can see, all of these highlighted areas here were all of the impacted houses in this particular ward. Now, this is a post that was on the Westmoreland Municipal Authority of Westmoreland County's Facebook page. There was a lot of communication happening via Facebook page as well as calling residents. They were calling residents a lot of the numbers. So it really makes you think about what happens in a time of emergency. There were a lot of landlines that they were contacting at that time. And unfortunately, a lot of those residents didn't have landlines at that point. They were moving toward cell phones. And so they were looking at many multiple ways, using media, using Facebook, and utilizing the phone to contact residents, and then frankly going door to door as well. And so the problem, there was a notice on the day of the event. There was an update, as you can see here, on July 19th. The do not use advisory remained in full effect in this lower 10th ward in McKeesport. And then the water authority immediately from that time forward continued then to collect water samples to test for the multiple types of PFAS chemicals that could have been exposed to. So as you can see, it came as late as August 12th when the problem was identified as corrected for the entire area and that folks would be able to use water as normal. When I tell you that there was an advisory not to use water, it was not to use water for any purpose in the home. So they were being told to go to the local high school for any bathing needs. They weren't using their dishwashers or washing machines for any water use. They were absolutely not using it for any consumption. And so it became quite a challenging situation, especially for residents who had mobility issues, and it was hard for them to get to another location to actually utilize the showers and such at the high school. So it was a very complicated situation and a very unfortunate one. And, it makes us all pause to think, what can we do as substitutes for this particular firefighting foam so that this doesn't happen again? So this is a timeline essentially of what had transpired. As I mentioned, on July 16th was the day of the event where this foam had backflowed. The do not issue water for water use was then on the next day, on the 28th of that month. Now, more than 10 days later, they indicated that the drinking water was safe to use for various parts of the 10th ward. However, the majority of the 10th ward didn't open up for full use until, as I mentioned, August the 12th, and that's when all drinking water restrictions were lifted. There was, as you can imagine, still quite a concern and hesitation by the community in terms of, is this safe? Am I at risk? Should I actually not use my water? And so these were things that we kept hearing as environmental health advocates directly from community members. So we had a distribution event. We had been using the zero water filters for the lead exceedances in the city of Pittsburgh, and we said, let's call the company and see if they would indeed be useful for this PFAS contamination. The particular filters for PFOS, and PFOA, it did filter for those. And so we collected dozens and dozens, if not hundreds, of water filters. We packed them up, and then we did a water filter distribution event. So each resident, each household got a water filter and then replacement filters, 4 of them. In essence, our goal was to provide about a year's worth of water filtration for the residents in that region. And the local church that is housed right in the lower 10th ward was a community partner, and they opened up their doors to us to help with this, not only with the water distribution effort then, but also door knocking and also then being that site for community meetings. So September 23rd, as you see, is the zero water filter distribution date. And then we also had been in close contact this entire time with Dr. Carla Engie, who is with the University of Pittsburgh and happens to be a PFAS expert. And that is that is the research that her lab focuses on at the university. We contacted her and then worked together as she was able to get a NIH grant through the National Institute of Environmental Health Sciences to do some sampling of resident homes. There was always this concern about PFAS and its chemical properties, whether or not it would perhaps even coat and stick to the pipes in the home. And so then her team got together with our team and we started doing some water collection samples, collected these samples over a period of many months. And then the team continued to sample and resample the homes to ensure that, and for residents' peace of mind, to ensure that there wouldn't be any residual PFAS exposure once the drinking water advisory was lifted. So here are the pictures that were taken during, and as you can see, there were people with masks on because this was still in the height of COVID exposure across Allegheny County in mid 2021. So this is a picture of our tabling where we were at the church doing the distribution. We literally had to fill up a U-Haul on a couple of occasions and take those filters down to the community's church for distribution. And then this is an example of the filter itself. So the zero water filter, we had, as I mentioned, distributed upwards of probably 100 plus of these water pitchers. The filter itself uses a combination of activated carbon in this ion exchange. So that had showed better than just using straight carbon alone. This has been a very effective filter for us to be using and distributing across communities in Allegheny County. There's a meter with each filter, so residents could use the meter to see when it would be time to change the filter. This is Dr. Carla and her team at the University of Pittsburgh. What they did was tested 16 homes. We went door to door as a group, and we talked with residents and we listened to residents and we heard their concerns. They looked at 13 samples inside 13 homes, and then they also took samples outside the affected area. And so they took 3 samples from each site in the house, in the kitchen, the bathroom, and the laundry tap to be able to get a good sense of where, in terms of how water flows through your home, where there might be an impact or a concern. So after that, we certainly then wanted to be able to have constant communication with the community. And that's one of the really important things, is that community voices were heard, but also we were sharing with community so that if there was anything that we could do to be a liaison between community and the municipal authority or the community and the local government, we were helping to be supportive in that space. We offered then 2 community meetings. In each of those meetings, then residents gathered to hear the results. We also went door to door to talk about the results, because looking at a lab report could be a very complicated process. So we wanted them to understand what the lab results showed. And if they had any questions, we could answer them directly with each resident. So this is Dr. Carla at the community presentation, the first one where she was giving results from the collection in December of 2021. And then we had a second one, as you can see on the far right-hand side. And then I wanted to also note that, there are organizations who are continuing to do this work across the country to understand industrial discharges. And so this is a mapping. If you go to the Environmental Working Group's website on their PFAS section, they've been able to map then industrial discharges. And so this is, of course, a map of the Commonwealth of Pennsylvania that shows you the expansiveness and the proliferation of PFAS from industrial sources just across the Commonwealth here. And then certainly this is another one that looks now at PFAS contamination, and this is interactive. So then you can click on a dot on the screen to see. And I looked at this in particular because not only did in our backyard do we have, for instance, a military site where there had been concern about discharge into one of the water authorities' drinking water access points, but also then you can look at other drinking water locations throughout throughout the state and throughout the country. So there are several policies, as I mentioned, that we are working on at the state level, and one of them is known as House Bill 1261, and this addresses PFAS and firefighting foam. This is addressing the situation that we were familiar with, that it was exposed, that we were working actively with in terms of exposure to the community of the lower 10th ward. Certainly, we have seen that also in training academies and other places where this foam has been used. And frankly, I will share with all of you, I saw the firefighting foam AFFF just used this past weekend in a brush fire in southwestern PA. And so if it's used in a brush fire, then there's the issue of, contamination to that soil, contamination to the ecosystem, contamination as that goes into the brush, and then perhaps there's a stream that runs through that particular property, and so it's a compounded effect. There is House Bill 675, and that's PFAS and PPE, and so that's the protection equipment, such as turnout gear that you'll hear a little bit more about. And then there's also the Senate bill, which is an accompanying bill to the firefighting and foam, so Senate Bill 980. We know that these exposures from all of these different sources of PFAS have direct health impacts and adverse health outcomes. So it's suppression of the immune system. It is certain cancers, certainly that are been directly correlated with exposure to PFAS. We've seen that in developmental delays in infants. We've seen that as liver and thyroid disease impacts. We've seen that in terms of increase in cholesterol levels. So there's so many unfortunate adverse health outcomes. And so those are the things that we want to avoid. Again, putting on that primary prevention hat of how can we think differently, how can we act differently, and how can we frankly demand advocacy and elected and legislative change to prohibit exposure to what we know is frankly at this point an unnecessary source of exposure, because there are alternatives that exist. So with that, why don't I just pause and we can turn it over to the next part of this presentation today. Andre, would you like to introduce our next speaker?
Yeah. Yeah, I just wanted to extend my thanks to you, Michelle, for talking about what this looks like in real time and the on-the-ground work that we was instrumental in. So thank you again. I'm really excited to now transition over to our other feature speaker, Dr. Kenny Fent. So Michelle, if you would stop sharing screen, and then
I will
Dr.
do
Fent can
that
go
for
ahead and
sure.
start his presentation. Thank you.
Yes, thank you.
Thanks, Andre. Thanks, Michelle.
Thank you.
All right. Everybody able to see that okay? See my slides? Great.
Yes.
So thank you for this opportunity to talk about, firefighters' risk of cancer. We heard a lot about PFAS. That's certainly one of the compounds that we worry about for, firefighter exposures, but there's quite a few others. My name is Kenny Fenn. I'm the team lead for the National Firefighter Registry for Cancer at NIOSH. I've been with NIOSH for 18 years. Most of my career has been focused on assessing firefighters' exposures to carcinogens and then different ways to help reduce their exposures. So when we think about exposures, we think about all the different ways in which workers can be exposed, and those are called exposure pathways. And so for firefighters, the exposure pathways are actually much more complex than I think a lot of people realize. The general public usually thinks about smoke and inhaling smoke. And certainly that is one way that firefighters can be exposed to potential carcinogens. But, a lot of these particles and even gases and vapors will condense. They will fall to the ground. They will fall on PPE and contaminate PPE. Some of those compounds, especially gases and vapors, can actually penetrate the protective layers of the garment and actually contact the skin directly. Contaminated gear, once you get out of a structure fire or vehicle fire, whatever the response is, those contaminants, many of those contaminants are volatile and they can off gas. And so if you're rehabbing near your contaminated gear, there's the potential for inhalation exposure to those off-gassing chemicals. And then, of course, you're going to touch a lot of those contaminated surfaces, get it on your skin. There's the potential for ingestion, absorption through skin. There's a potential to take a lot of that contamination back to the fire station, or it could contaminate the apparatus. And so many of these exposures at a fire ground, it really extends beyond the scene of the fire. And it can potentially expose firefighters, if they wear contaminated gear during other types of responses, like medical responses. In terms of the types of chemicals that can be released during fires, we have characterized over 30 known, probable, and possible carcinogens. And that includes benzene, which is one of the most carcinogenic toxic compounds known to man, formaldehyde, polycyclic aromatic hydrocarbons, arsenic, asbestos, dioxins and furans. I could go on and on. So these fires are known to produce a lot of very hazardous chemicals. When we think about the specific routes of exposure, like I mentioned, inhalation exposures, of course, that is the most direct route of exposure. It's a very important route of exposure for the firefighters, and it really depends largely on their use of SCBA or respiratory protection in the hot zone, as well as their location relative to the fire. Are they upwind or downwind? And sometimes they can't help it. They do have to set up commands. Sometimes they're downwind, or sometimes the wind shifts. They're not always going to be wearing a CBA if they're, on a pump truck, for example. And so there is that potential for inhalation exposure. We know that with combustion, the particles are very small, typically less than 2.5 micrometers in diameter. That's a fraction of a hair, the width of a hair. And so these really small particles, you can't even see them by the naked eye. They're able to penetrate very deeply into the lower respiratory system. That's the area of the lungs where you have gas exchange, so you can absorb a lot of those chemicals. It's also the area of the lungs where clearance mechanisms are less effective and lung inflammation can occur. There's also the potential for dermal exposures and dermal absorption. So one of the compounds that we worry the most about is polycyclic aromatic hydrocarbons, or PAHs. They make up a lot of soot. So, you have that really dark black smoke, that's soot, that's going to inevitably contain PAHs. And what we know is that if you apply PAHs to skin, anywhere from 20 to 56% of the PAHs will be absorbed into the body within about 6 hours. And that rate of absorption is even faster for thinner skin. So think about the neck as being one of those areas. And so just to illustrate this point, we have this figure here. This is a firefighter before and after entering a room that's filled with fluorescent dye aerosols, wearing full bunker gear. And as you can see, the neck region in particular is vulnerable to exposure. And that's because for firefighters, they primarily protect their neck skin with hoods, 2-layer Nomex hoods. And a lot of that particulate can penetrate the hood material. We also see around the wrists. We also see on the lower parts of the legs. Those are considered interface regions of the turnout gear. And so, some of these particles can contact the skin, as I mentioned, and potentially be absorbed. Now, even with some of the volatile organic compounds, or VOCs, even though they're vapors in the fire environment, studies have found that some vapors can be absorbed directly through skin. One example is benzene. Up to 1% of benzene vapor can be absorbed. And the rate of absorption for benzene increases with increasing skin temperature, sweat, and humidity, which of course are all factors that are going to be present in firefighting operations. And there have been animal studies that have shown that if you apply benzene to the skin of a rat or mouse, that you can measure exhalation of benzene in their lungs within about 30 minutes. So clearly there's, potential for absorption of benzene through skin. As I mentioned, there's a potential for cross-contamination. So the firefighter's PPE is likely to get contaminated during firefighting operations. One thing that firefighters typically do when they come out of a structure fire, one of the first things they do is pull their hoods down around their neck. And the hoods are one of the most contaminated items on a PPE ensemble. And so a lot of that contamination on the outside of the hood can then contact directly to the neck skin. So even if the hood did its job and protected them from some of these aerosols, it can then just transfer to the skin when they're doffing. Firefighters often also take off their gloves immediately after firefighting. Gloves are also highly contaminated. They'll hold the gloves in their hands, and now their hands are contaminated, and now they're touching other areas of their bodies. And then, as I mentioned, PP ensembles can also off-gas volatile compounds like benzene after removal, and that could expose firefighters through the inhalation route. And then one interesting finding is that a lot of structures, we just heard about PFAS being a common component of a lot of different items, and flame retardants are another chemical that's added to a lot of our furnishings and foams and things that are in our homes and businesses. Those can be released during firefighting. They can contaminate PPE. And what we've found is that a lot of the flame retardants that we're measuring on PPE are the same flame retardants that we're measuring contaminating the inside of fire stations. And so that would suggest that cross transfer of contamination from the fire ground to the fire station. A lot of these contaminants in a fire environment can also break through the protective barriers of turnout gear. We've conducted air sampling outside and under turnout gear during live fire conditions. We've done this type of study on mannequins as well as actual firefighters who are going through training. And what we have found is that turnout gear provides very little protection against volatile compounds like benzene. And in fact, we've found almost 100% breakthrough of benzene to the inside of the turnout gear. However, turnout gear does provide a bit more protection against less volatile compounds like naphthalene, naphthalene being one of the more volatile PAHs. And basically what's happening is that the less volatile compounds are more likely to exist as particulate, and the turnout gear is more likely to capture the particulate before it's able to really penetrate the barriers of the turnout gear. And so if you tighten those interfaces that I mentioned around the neck, around the wrist and the waist, that's going to provide even more protection against those less volatile compounds that are more likely to be particulate in the fire environment. Now, what's most important when you do exposure monitoring is it's not just what's in the air or what gets on the skin, it's really what gets into the body. And so that's when we would do biological monitoring. We collect blood and urine and even exhaled breath. And we do this before and after firefighting, and we see if there's an increase. And what we have, not just us, not just NIOSH, but many, many researchers have consistently shown that firefighters will absorb many of these compounds into their bodies during firefighting, irrespective of the level of protection from their PPE. So this is just an example of xylenes, toluene, styrene. For attack and search firefighters, we see an increase before and after firefighting across the board. We've seen the same thing for exhaled levels of benzene, in breath, as well as PAHs in urine. Now, when I give this presentation, sometimes I feel a little bit like, the bearer of bad news, but there is some good news. There are many control interventions that are available to the fire service, and there are many progressive departments that have implemented these various controls. And so over the years, NIOSH has evaluated the effectiveness of these controls, and this is just a few examples. So using skin cleansing wipes, commercially available cleansing wipes that you can get in any department store, can reduce exposures by as much as 54% on the neck skin if you clean the neck skin, just as an example. Doing preliminary exposure reduction or gross decon can reduce 85% of the pHs on the exterior surface of a turnout gear. Of course, segregating contaminated gear after firefighting, bagging the gear, that's going to reduce that potential for off-gas exposure. Laundering gear after firefighting can remove 76% of pHs from hoods as one of the more contaminated pieces of the ensemble. Overhead removal of hoods, so this is where instead of pulling it down around the neck, the firefighters would pull the hood up and over their face mask. We found that can reduce pH exposure on neck skin by up to 80%. Hazmat style removal of fire gloves, very common with EMS operations. That type of removal can reduce that potential for cross-contamination. The way that firefighters attack, so their tactics can make a difference. Transitional attack is where firefighters would hit a fire from the outside through a broken window, try to knock it down before they transition to interior attack. That type of tactic can reduce urinary metabolites of some of the pHs by up to 50%. Remaining upwind of a fire can reduce exposures by up to 80%. And then implementing a variety of these types of controls. There's been some studies that have looked at fire departments that have implemented many of these, and they found that can reduce absorption of some of these pHs by up to 36%. Now, clearly, I've talked a lot about firefighters' exposures to carcinogens. Without a doubt, firefighters are exposed to a variety of different types of carcinogens. But what is their cancer risk? And one of the largest and most important studies that has been conducted to date was this NIOSH firefighter cancer study. This was performed on firefighters from 3 departments, San Francisco, Chicago, and Philadelphia. It was a records-based study, firefighters employed between 1950 and 2009. And we matched to the National Death Index as well as state cancer registries to assess their risk of cancer. And what this study found, and this was published in 2013, 2014, is that firefighters have an increased risk of dying from cancer of about 14% and an increased risk of being diagnosed with cancer of about 9%. And this was largely driven by digestive, respiratory, urinary, and oral cancers. And then there was an update done in 2020 that found that they also had an increased risk of non-Hodgkin's lymphoma. This study also looked at associations between estimated exposure through fire hours and fire runs and found associations with lung cancer and leukemia. One issue that we have right now is that many of the studies that have been done have not had enough female firefighters or enough firefighters from other racial and ethnic minority groups to really be able to draw statistical conclusions. And even with this study, the NIOSH firefighter cancer study, which had almost 30,000 participants, that was true. Still, we found evidence that non-white firefighters had elevated prostate cancer diagnoses and that female firefighters had elevated bladder cancer death and diagnoses, as well as increased risk of breast cancer. But again, those were statistically non-significant because of the sample size. Whoop. I don't know what I just did. There we go. Okay, so the NIOSH study, that was a very important study, as I mentioned. It's conducted in 2014. And there have been a number of other studies throughout the United States and the world that have looked at firefighters' risk of cancer. But how do you make sense of all of those different studies that have been done? And fortunately, in 2022, the International Agency for Research on Cancer, or IARC, did an evaluation where they looked at all the evidence that existed at that time to be able to classify firefighting in terms of its carcinogenicity. And I had the privilege of being on this work group, and the work group decided to classify firefighting as a known human carcinogen, group 1. And this was based on sufficient evidence of mesothelioma and bladder cancer in firefighters, as well as limited evidence for 5 other cancers: colon, prostate, testicular, melanoma of the skin, and non-Hodgkin lymphoma. They also looked at mechanisms that, biological mechanisms that are known to increase the risk of cancer. There are 10 biological mechanisms that they consider, and 5 of those mechanisms were found to have strong evidence of existing among the firefighting population. And so this is the most comprehensive analysis that's been done. Again, there's 7 cancers that there's either strong or pretty strong evidence that it's associated with firefighting. That said, there are several questions that still remain. And so those questions are really what motivated the creation of the National Firefighter Registry for Cancer, or NFR. And our mission is to generate detailed knowledge about cancer in the fire service through a voluntary registry that reflects our nation's diverse firefighters, and then to take what we learn and give it back to the fire service and public health and medical communities so that they can help reduce firefighters' risk of cancer. This was created through an act of legislation, the Firefighter Cancer Registry Act of 2018, with broad support from various fire service organizations throughout the country. So I mentioned the questions that remain. Some of these questions are, how does cancer risk vary by exposure? How important are, major events, disaster responses, exposure, cumulative exposure over time? Is there an increased risk of rare types of cancer? So to really be able to study rare forms of cancer, you need a really, really large population that you can follow over time. What is the cancer risk for volunteer firefighters and wildland firefighters? They've been vastly underrepresented in research to date. And then also the cancer risk for female firefighters and other demographic groups also been underrepresented. Now, cancer is a reportable illness in all 50 states. So that's a good thing that is a reportable illness. However, many states do not capture detailed occupational information. And in fact, many states don't collect any occupational information. And that's a problem, because if we want to look at if firefighters are being diagnosed at a higher rate of cancer, we need to know that they're firefighters. And that, unfortunately, isn't happening nationwide. And so that's really the missing piece of the puzzle. We know that firefighters have occupational exposures. We know that they're being diagnosed with cancer and that we are tracking cancer diagnoses, but we're not tracking that they're a firefighter. And so at the most basic level, the NFR provides firefighters with an opportunity to tell us about themselves and their work as a firefighter or volunteer service as a firefighter, so that if they're ever diagnosed with cancer, even 20 or 30 years down the road, we're able to match that cancer diagnosis with their profile. And now when we do that for firefighters across the country, we can learn a lot more and start answering a lot of these knowledge gaps that remain. In terms of who can join, the NFR is for all firefighters in the United States. Importantly, with or without cancer, you do not have to have cancer to register. This is an exposure registry. It's just as important that firefighters without cancer register. And then, of course, we're very interested in a lot of these groups that have been underrepresented, that I've already mentioned. And so, certainly, if you know anybody in your family or that you work with anybody that's a firefighter, please let them know about this opportunity. So why do we need Firefighters Without Cancer to join? Again, this is an exposure registry. All firefighters have some level of exposure. And we really want to know why some firefighters develop cancer and others do not. And so that's why it's just as important that Firefighters Without Cancer join this initiative. And as I mentioned, we'll be able to follow them over the next 20, 30 years and beyond. In terms of how we're doing right now, we have more than 45,000 US firefighters who have registered. That makes the NFR the largest group of firefighters ever assembled in the United States to study their risk of cancer. It's probably the largest group in the world. So we are off to a fantastic start, but we've got a long way to go. We want to try to build this to 200,000 firefighters over the next several years. To sign up, it's very straightforward. This QR code will actually take you to the enrollment website. Basically, you would create an account, give your informed consent, and create your profile. Those first 3 steps can legitimately be done in about 5 minutes. Once you create your profile as a firefighter, you will get an NFR participant number. You will be in the registry. We will be able to track any cancer outcomes that you have over time. Step 4 is the NFR questionnaire. It is a comprehensive questionnaire. It asks about work history as well as health history. It does take a bit longer, 20 to 30 minutes, but firefighters can log out and back in as they need. The fire service, as well as many professions, is really data driven. Right now, we're enrolling firefighters across the country. We're building the registry. We will be also obtaining records. So I mentioned, linking with cancer diagnoses that are reported to states. We'll be doing that. But we're also interested in capturing information about incident responses. There's a system called NERIS. It's managed by the U.S. Fire Administration. We're hoping to work with them to be able to get that information, and so that basically firefighters don't have to report it to us. We'll be able to leverage existing data sources and understand over their whole work history the exposures that they have. And then, we want to make the data. Of course, we're going to protect the data. We have an assurance of confidentiality. We're going to maintain privacy and confidentiality. But we do want to de-identify the data and make it available to external researchers. We're required by law to do that. That basically empowers other researchers to be able to look at the data and draw even more, do even more analysis and draw more conclusions from it. So this is a ad campaign that we're running right now. It says, if you knew your story could help prevent cancer in the fire service, would you share it? And I think this really kind of hammers home this point. Not every firefighter will develop cancer, but every firefighter has unique experiences and exposure profiles. And when they share that data and when it's combined with hundreds of thousands of other firefighters throughout the country, we can learn a whole lot more about their risk of cancer, which types of cancers are elevated, and what is it about firefighting that's increasing that risk, or even decreasing the cancer risk. Because we are asking about some of these protective practices. We want to see if those protective practices are helping to lower the risk of cancer for firefighters. And you can imagine how powerful that information can be to the fire service and our public health and medical communities. A couple other things just to mention real quick. We want to recognize our fire departments and other organizations that are really going above and beyond. Any fire department that's able to encourage and help enroll half of their firefighters in the NFR will be recognized as a gold helmet department. They'll get a web badge and a certificate and be named on our website. So far, we have more than 120 departments that have achieved that status. We also want to recognize our organizations that are helping to advocate for the NFR. If these organizations do 3 different activities to promote the NFR throughout the year, they'll be recognized as an NFR champion. Same thing, they'll get a certificate, web badge, and be listed on our website. And so I know we're like towards the end of our time here, but I do appreciate everybody listening to this presentation. We have an email here. Please feel free to email me. We have all sorts of professionally printed materials and other things, videos, you name it, that we can share with anybody on this call who wants to help get the word out about the NFR. Thank you.
What a fantastic, incredibly in-depth conversation and so varied. I've worked in this space for years, and this was some of the first time I've heard this information. So it was incredibly informative to me, and it's definitely going to inform the work of my organization. So just want to offer my thanks again. Um, we are close to the top of the hour, but I still do want to make space for an audience Q&A. So we're going to transition there now. If you have any questions, please put them in the chat, raise your hand, unmute, then we will address them. First, I did see Rob, you put a question in the chat earlier, so we can address that one first. Rob asked a question for you, Dr. Finn, specifically. He asks, can you address the non-use of SCBA by firefighters, even going into burning structures, such as seen on videos for big fires lately in New York and Chicago, for example?
Yeah, I mean, I think by and large, policies throughout the country at fire departments is to wear SCBA during active firefighting operations. What becomes challenging is like these really long-lasting types of fires. Canisters, air cylinders last, even a 45-minute bottle will only last 30 minutes. And so they have to exchange those. And that creates some complexities for fire departments in managing those kinds of incidents. From a health and safety perspective, it concerns me a great deal because, as we just talked about with both presenters, is that like there are so many different chemicals that are released from these types of fires, and no single fire is the same. And in fact, there have been some incidents with EVs, for example, electric vehicle fires, where they thought it was out. It went back into thermal runaway. It exposed firefighters. The firefighters got very sick. So, you can't ever sort of know for sure that you're going to be safe at a fire ground if you're exposed to smoke.
One of the things that we heard from the retired chief in the city of Pittsburgh fire department is just making certain that his team knew that fires were burning hotter and faster and more toxic than they had in decades prior to. Yeah.
Yeah.
Thank you for your question, Rob. I know we are at the top of the hour, but still want to make some time. Do we have any additional questions for either Dr. Finn or Michelle? Please ask again, Rob, please.
Sure. Can both of you maybe address how do we get fire departments to take this seriously? Because you brought up, Michelle, you brought up Pittsburgh. This is the research I do towards my PhD. And I've been trying to get Pittsburgh Fire, their union involved. They don't want to talk to us. They don't mandate decon. They don't even have annual physicals or health and wellness divisions. So it's very frustrating for them. We get better cooperation from our volunteer fire departments than we do from Pittsburgh.
I'll just share personally, when we stood side by side, the firefighters in the union on TSCA reform in 2015, 14, 15, 16, frankly, they wanted to make sure that the International Association of Firefighters was on board. And when they got that nod, they were all in. And so I put that comment in the chat. And so I think that that's one of the things that I've seen personally in the field is that they're looking to their associations and the stance that they take, and that helps give them direction. And so if there are other, both at the state level and national level, the investment from the associations to lead in this space, I think it's very powerful and important. And I'll just leave it there. And so perhaps Kenny would
Yeah.
have some more to say about that.
Yeah, I mean, I agree completely. The union carries a lot of weight. Sometimes it's a national level of the union, sometimes it's more the local level. It sort of depends on the department. I also think that, you know, fire departments and the general public, we tend to be reactionary, right, instead of proactive. A lot of times it takes somebody getting sick. I mean, I hate to say this, but somebody gets sick, somebody gets cancer, and then it's a wake-up call. And I think, you know, not always, there are just some very proactive departments out there. But we have definitely seen where, you know, that has happened and the department does a complete 180. And, you know, health and safety becomes a big priority.
And I'll also say, I've spoken with numerous fire departments across our region. And for instance, looking at AFFF, they know it's toxic. They've literally said, I've got barrels of it sitting in the corner of my station. I know it could be a super fun site waiting to happen. But it's an investment for funding as well. So making certain that there's funding set aside, federal, state level, because we do have replacements. There are replacements available now. But the problem is disposal of what we have sitting in corners, being ready to use for things such as an electric vehicle fire or brush fire out in the community. But then also having the funding to buy the replacement, and that's just proper disposal and storage of what we've got too. So it is a complicated factor because we know that volunteer fire departments are relying on bingos, they're relying on fish fries just to keep the doors open, and getting a little bit of grant monies from the state. So all of those factors, I think, play into really significant systemic change that we know needs to take place.
I think from the discussions today, it's clear that this is important yet very complex. And I really appreciated the angle that both our presenters, Dr. Fitt and Michelle, touched on throughout the presentation. Given the time, I think it is appropriate to go ahead and close. So I wanted to extend gratitude to both Dr. Fent and Michelle again for just offering such incredible information regarding activity in the community, regarding the NFR, regarding firefighter exposure, and so many other aspects of the conversation. So thank you so much. This recording will be distributed, so we will make sure that people most impacted will definitely have access to this critical information. Thank you so much. I will share out any additional resources shared throughout today's presentation and a follow-up email tomorrow. And I will also include the email that you shared, Kenny, so anyone can get in contact with you regarding some of those next steps. So thank you again for joining us today, and we will be in touch soon.
Thank you. Appreciate it.
Have a great day.
Thank you. Have a great day.
Bye.
Bye-bye.